It's interesting around, how doctors manage the time, this, kind of midlife area with men, because it is partly testosterone levels, as you rightly say, and these are shrinking and these are reducing in men quickly, along with sperm, sperm count. These are happening to men earlier and earlier.
Yeah.
And there's a lots of theories around why that may be, but some of those have got to be cultural, right? Some of those have got to be what boys are being taught when they're young. Some of that's got to be around, a lack of allowing boys to be boys as they're growing up, and therefore when these boys turn into men, a lack of men's spaces. And it's interesting that you say that the answer was to just chuck men onto antidepressants. That's, there's some really good, I don't know if you've heard a guy called Adam Lane Smith, but he started doing a lot of stuff around, the podcast scene, but he talks about men's depression and this kind of, anxiety and anxious phase or time within a man's life, and it can be sporadic and it can happen anytime. But he started talking about mission and purpose, really, and just how different men are, just what different things men are looking for when they're feeling anxious.
Exactly. No, it's a very good. Before I forget, sorry, Jason. You mentioned mission there. Chris Williamson, the guy who's got a podcast.
Modern Wisdom.
Modern Wisdom, exactly. And he talked about this maybe 2 or 3 weeks ago, and it related back to your first point you made about treatment and how it's very femme-centric. So treatment for depression is very femme-centric. Talking therapy, psychotherapy, all that stuff. It works for women. Doesn't work for men. Purpose and mission works for men. And Chris Williamson gave the great example of in World War II when men were comatose. Have you seen that video?
Yeah. I've seen the study actually. I can remember seeing it. I can remember seeing it after, and I think it was in the podcast with Adam Lane Smith actually.
Oh right, okay. Right.
When then I've got he's got a brilliant quote. We put it on our Man Clinic site. I'm going to butcher it, but it's something around depressed men don't need medication. They need a mission and a purpose. Give a man those two things and a means to achieve it, and they'll crawl over broken glass and smile. And it's just so right. It's adaptive.